now we're going to be talking about we were talking about small messengers till now, peptides. Now we're going to get a little more deeper, getting into the master builders. You want to guess? Which are the master builders? Stem cells. Stem cells, yes. Definitely coming with a lot of opportunity of growth. The kind of potential that you can get from stem cells is something that you definitely should explore. That is why we included this session, this special session, for you to understand the power of stem cells. Just give me a minute. So, for actually explaining us this exciting world of stem cells, we have Ms. Nirupa Vyas, who is the CEO of Total Potential Cells. And of course, she has been a pioneer for the growth of the stem cell therapy field in India. She's got a medical background and she's definitely passionate and has helped regenerative medicine definitely become more accessible to the people so that they truly know what their bodies can do. So, with a warm applause, let's welcome Ms. Nirupa Vyas.
Hello. Hello everyone, I'm Nirupa Vyas and I am the co-founder of two stem cell companies, Total Potential Cells Private Limited.
Let's swap the mic.
Hello everyone, I'm Nirupa Vyas and I am the co-founder of two stem cell companies, Total Potential Cells Private Limited and Sushruta Innovations and Wellness Private Limited. We have been doing fundamental research of stem cells since 2007. In this journey, we started with doing only fundamental research on mesenchymal stem cells. We were awarded 2 projects by Department of Biotechnology, Government of India in 2011 to validate what we were doing in the lab. The first project was on differentiation of human adipose tissue-derived stem cells to islet cell aggregates as a treatment, as a regenerative medicine for diabetes. Here we were given permission to do a phase 1 clinical trial. The second project was on the process of preparing mesenchymal stem cells for the treatment of osteoarthritis as regenerative medicine. Here we were given permission to do a phase 2 clinical trial of 25 patients and 50 knees. Both the projects were successfully completed, the results published, and finally we have been awarded 2 process patents by the Government of India. So we are also awarded a DSIR recognized lab, which also is a class 5 lab to carry out all the research. After doing all the research on the bench, in 2015, we did the process of taking all this research to bedside, wherein we are offering stem cell therapy for a host of autoimmune conditions, osteoarthritis, diabetes, liver cirrhosis, chronic kidney disease, and of course, now in this exciting world of anti-aging and wellness therapies. So I'll just start with what is regenerative therapy, and just a few basics about stem cells. So regenerative therapy is the therapeutic applications of stem cells based on their potential to stimulate repair mechanisms and restore function in damaged body tissues or organs. regenerative therapy utilizes human cell and tissue products. So the examples are stem cell therapy, platelet-rich plasma therapies, to name a few. The human cell and tissue products secrete compounds called growth factors, cytokines, that aid in the treatment with chronic and degenerative diseases. This therapy stimulates natural healing processes by stimulating the reparative response of aging, diseased, dysfunctional, or injured cellular tissue. Some of the relief is immediate. The inflammation in the area treated is reduced, and there is a significant reduction in pain. Some other regeneration takes the investment of time depending on the damage and the immune system of the patient. So let's just go into what are stem cells and how do they work. The stem cells are unspecialized cells in our body that can differentiate into various cell types and thus can help in the process of regeneration. They have a property of angiogenesis, that is the formation of new blood vessels. They are anti-inflammatory and antimicrobial in nature. They also possess the property of immunomodulation, that is, they change the body's immune response. And lastly, they stimulate regeneration at the site of the damaged or injured tissue. So they are capable to repair, regenerate, and renew damaged tissues. And now let's take a deep dive into mesenchymal stem cells, which has been our area of research. The definition of mesenchymal stem cells is that they are multipotent stromal cells that can differentiate into a variety of lineages. That is, they have the ability to differentiate into cell types of different germ layers. That is the ectoderm, the skin, mesoderm, bones, and cartilage, and endoderm is the organs. Stem cells derived from the ectoderm, that is the skin, can translate to form neural cells in the brain. This phenomenon is referred to as cell transdifferentiation or plasticity. The mesenchymal stem cells are immunonaive. A person's immune system will not reject the mesenchymal stem cell transplant. Thus, this therapy can reach a number of patients without a graft versus host reaction. So these are some sources of mesenchymal stem cells. Sorry? That's okay. So there are various sources of mesenchymal stem cells. Basic differentiation starts from the autologous stem cells and the allogenic stem cells. So the bone marrow derived mesenchymal stem cells are the most commonly used and well studied and fall under the autologous stem cells. Also, other examples of autologous stem cells are the adipose tissue or fat, which provides a more abundant and easily accessible source of mesenchymal stem cells. The allogenic sources would be the umbilical cord blood, Wharton's jelly, placenta are the rich sources of mesenchymal stem cells. So the autologous cells come from a person's own body and allogenic cells come from a donor tissue. I can safely point out that very few parents bank the cord and the cord blood of their newborn babies in private cord blood banks. So when there's a complication at the time of birth, these tissues could have come handy for the children. If if the child is not crossing milestones, the pediatrician will advise a stem cell procedure by injecting the stored cord blood of the baby to achieve normalcy. And this is where the autologous regenerative therapy is very convenient, wherein own tissues can be taken, processed in the labs, and injected back at the damaged area to regenerate the damaged tissue. So if any one of you would require stem cells, all you have to do is to look inside your body. But as the concept is about 20 years old, parents, grandparents, I think everybody in this audience will not have their tissues stored. And this is where the allogenic stem cell therapy gains a lot of importance. Now, these are some of the cell lineages that mesenchymal stem cells can differentiate. A mesenchymal stem cell will differentiate into chondrocytes, and that becomes the cartilage. MSCs differentiate into myocytes, which become muscles. MSCs differentiate into adipocytes, which become fat, and so on. The astrocytes will become the part of the CNS. Again, mesenchymal stem cells also are immunonaive. A person's immune system will not reject the mesenchymal stem cell transplant. Thus, it is a very, very accessible and easy therapy to do. These are all the advantages of using mesenchymal stem cells. They are self-explanatory. The mechanism of action through which stem cells can promote the regeneration of tissue are diverse. They include the inhibition of inflammation cascades, the reduction of apoptosis, the cell recruitment, stimulation of angiogenesis, differentiation. The minute the IV of stem cells is given, the mesenchymal stem cells start migrating to the damaged area and start intense proliferation. This is also called as honing, that the cells will actually know where they need to hone to go and repair. They don't need to be particularly injected at the site. Though there are protocols wherein in liver disease, in the osteoarthritis patients, where we actually go to the site and do it, but the IV also has very good results and can also be done in a clinic setting. They basically activate the neighboring stem cells to start the process of regeneration. There are various clinical applications for mesenchymal stem cells. If you all would know, Sachin Tendulkar, for his tennis elbow injury, went to the UK to get a stem cell injection into the elbow to treat it. We have also treated multiple sports injury and working very closely with sports medicine doctors. Osteoarthritis is one of the conditions where MSCs give very good results. When the patient has come in with a grade 1, grade 2 osteoarthritis and has been advised some sort of invasive therapy, the therapy of mesenchymal stem cells really works wonders. This is a brief diagram of exactly how, what the tissue goes through. It's the lab procedure to show what the tissue will go through to make mesenchymal stem cells. It's basically, in this 25 patients that we had done, we had recruited a plastic surgeon to do lipoaspiration of the fat. After that, the fat is taken to the lab and multiple steps are done on that along with centrifugation, and this SVF is isolated. On the same day, the SVF is then re-injected into the patient's knee. The following criteria were evaluated for all the patients. We evaluated criteria of the range of motion, pain, walking, climbing, and a visual analog score. And after the year 1, 24 out of 25 patients scored between 9 and 10. We have been in follow-up with all these patients, and till date, none of them have needed to opt for a knee replacement surgery. There are other clinical applications also of mesenchymal stem cells which give very good results in the neurological conditions which are degenerative and in which there is really not a hope that there is a cure for the patient. What stem cell therapy aims to do is to halt the progression of the disease. We have treated patients with Parkinson's disease, dementia, Alzheimer's, where from the constant feedback that we get from the relatives of the patient is that though there has not been a cure, there has not been a deterioration to the condition that the patient came us with. For cerebral palsy, autism also, where the children are not crossing milestones, this is a therapy which offers great hope. And this is literally the only therapy that would be prescribed to the patient, because else there isn't really anything that the medical science offers. Talking of liver cirrhosis, this is also an area where we have got very good results with patients. To cite a recent case, in August 2024, we had a patient who had collapsed and was in the ICU with grade 4 liver cirrhosis for a month. He was advised an immediate liver transplant. His blood readings only would not have allowed him to go on the table, and that is when he was referred to us. From August 24 till date, we gave him 2 cord blood infusions and an infusion of mesenchymal stem cells. And this, when we are actually going to present it as a case study, and we see that the results are very encouraging. And he may, if this is the way he's going to be improving, he may avoid a liver transplant for a while. During COVID also, there was a trial that went on in China, and we had also got a permission to do it in our labs, wherein the COVID patients having COVID-19, we gave mesenchymal stem cells IV with very good outcomes. A lot of young patients were given steroids, and that caused them avascular necrosis of the hip joint. And patients were told to go in for a hip replacement because the damage was so much. Again, the injection of mesenchymal stem cells at the site has given very good results, and 4 years and counting, and no need for the hip replacement. Then finally coming to the anti-aging therapies that we also offer. As we age, our cells accumulate damage and eventually enter a state of senescence where they no longer divide or function properly. Mesenchymal stem cells have been shown to secrete growth factors that can reduce this cellular senescence and promote the regeneration of tissues. Chronic inflammation is also the hallmark of aging and is linked to many age-related diseases. Mesenchymal stem cells possess strong anti-inflammatory properties which can help reduce this inflammation. Finally, it is anti-aging using mesenchymal stem cells for skin and hair also gives very good results, wherein the MSCs are mixed along with platelet-rich plasma and injected on the face, popularly known as vampire facials, to stimulate collagen reproduction and improve the skin texture and tone. These are some of the results of our patients, wherein hair also and face also was done. So it promotes a more youthful appearance by stimulating collagen production, and hair fall and hair thinning also is helped. These are the results after 6 months of injection of PRP along with mesenchymal stem cells. Finally, I'll touch upon the topic of exosomes, which we are currently researching and having very good results and patient outcomes. Exosomes are tiny particles that are released by cells, including the mesenchymal stem cells. They act like messengers carrying signals to help the body repair itself. You can think of them as text messages between cells, instructing them to reduce inflammation, stimulate healing, or grow new tissue. The exosomes are 30 to 150 nanometer signaling nanoparticles that deliver the microRNAs, proteins, and growth factors to activate, repair, and regenerate cells. And this is a very powerful cell-free therapy in regenerative aesthetics as well as anti-aging and wellness IVs. Exosomes derived from mesenchymal stem cells. There are all type of exosomes in the market where you get animal-sourced exosomes, but particularly the exosomes which are derived from the mesenchymal stem cells are valued for their regenerative and therapeutic properties as they are rich in bioactive molecules, including growth. They modulate the immune response and enhance the cell survival. These properties make the mesenchymal stem cell-derived exosomes highly beneficial for application in the wellness therapies. Finally, there are just a few challenges to the mesenchymal stem cell therapy, that the production and the administration of mesenchymal stem cell therapies are expensive and they are not covered by insurance. And as with all other therapies, lifestyle modifications are very important to the success of this cell therapy. So as Dr. Ashwini showed us the pyramid of the treatment modalities for longevity and anti-aging, regenerative therapy comes on top of that pyramid and uses modalities of stem cells and exosomes. So what I leave you all with is that next time around, when you are treating your patients, please do research whether stem cell therapy could also be included along with your protocols. Thank you.
Thank you so much.
This is yours. This works.
Thank you for the mic, which everyone can hear. Thank you so much.